cool. Cindy, how are you?
I'm good. How are you?
Good, I'm doing great. I'm just gonna do a couple more little tech things here.
Mm-hmm.
Awesome. So I just want to give people a little bit more time to join us. How's it going in Las Vegas?
It's good.
Yeah.
The weather's warming up, so
Okay.
I can't wait.
Yeah, I know.
It goes to nice, and then eventually it'll become like hellish hot. But right now, we're heading into nice.
Good. Well, I don't want people to miss our exciting conversation, so
Yeah.
you and I can hang out for the next few minutes until people join us. How's your day been so far? What have you been up to today?
Not much. I won't lie. I slept until 9:30 a.m.
Nice.
Yeah. Wednesdays I don't see patients, so it's an added day for me.
Got it. Yeah. Good.
How about you? How are things up there?
Really good. I mean, I think obviously it depends on where you live in this country, but we're very fortunate in the Bay Area that things are pretty good here. And today, April 22nd, is when we were mandated in our county that everyone needed to wear a mask, and essential workers have to wear masks at work. And we've already actually been doing that here.
Yeah, that's true. Wearing masks, well, I should say about 3/4 of the population wears a mask. The other quarter, it's laissez-faire.
Yeah.
Mom is asking if we're live.
We are, yes. Excellent. Well, thank you for setting aside time to be with us today.
Thank you for having me. I'm a huge fan of the Egg Whisperer show. I'm the Egg Whisperer, so happy to be here.
Thank you so much. Thank you. Well, I hope, I know people will learn a lot from us today.
I'm excited.
Yeah, me too. I just want to give people a little bit more time to join us, get their lunches out if you're on the West Coast. Get a snack if you're on the East Coast. Okay, guys, I'm here with Dr. Cindy Duke for an episode of the Egg Whisperer Show, and we're going to talk all about coronavirus and fertility and pregnancy, and also more coronavirus. And there is a reason why I have Dr. Cindy Duke on the show. She is kind of a big deal. She not only is a fertility expert, which means she went to school for a really long time to figure out how to make a baby, but she also is a virologist or a virologist, and I'll let her pronounce it correctly for me. She has a PhD. So Cindy, tell me what all that means for our
people. Actually, you can say virologist or virologist. It all depends on where you're from. I tend to say virologist, but time and time again, I'll also say virologist. So I have a PhD in microbiology and immunology, which means I spent 4 years in addition to the 4 years of medical school. I did an MD PhD program, or what we call a physician scientist training program. And in my 4 years, I worked on developing vaccines for viruses. So for 4 whole years, all I did was study the human immune response and how you can manipulate it using viruses and different viral vectors to create vaccines and immune responses for improving health and preventing infection.
I mean, some people might say a sperm cell is a form of a virus infection. So I guess it makes sense to go from viruses to fertility, but what's the connection? Like, how did that happen?
For me, they actually went together naturally. First of all, microbiology and immunology really spans the study of all things infectious and also how DNA gets into cells. And the whole crux of fertility is understanding how how DNA comes together to form a human being. And of course, viruses are some of the oldest particles on Earth. And viruses have been around even before, if you believe in evolution, before human beings truly evolved. And so they've played integral roles in dictating how our DNA and our chromosomes came together. And for me, that was natural. Also, you can use viruses for gene therapy. And that's essentially what a vaccine is. It's gene therapy. I left the window open, but it's gene therapy. And so, when you do viral vaccine candidate, you're really manipulating genes, you're changing genes, and you're introducing them into cells, new DNA, new RNA to code for what you're looking for. And it's very much gene therapy. So to me, they naturally came together.
Very cool. And so tell me about your practice, because you're in Las Vegas right now, and
I am.
You're also a fertility doctor. So if a patient wants to see you, and how do they do that?
Well, Dr. Aimee, I have to be honest here. You are one of my mentors, in that watching you and seeing you in practice motivated me that I could start my own practice. So I'm in Las Vegas. I have a clinic called Nevada Fertility Institute, which was founded back in 2016. And at this point, we are a full service clinic. We treat men and women and those who are working on transitioning. And we help people get pregnant, whether it be IVF, intrauterine insemination, for those who are looking to freeze eggs or sperm, for those who may be dealing with cancer and need to freeze eggs or sperm in that context, we do that. And we've been here since 2016 and making strides.
Awesome. And I hear you talk about your mom a lot on social media. Does she watch you when you're doing interviews?
She does, when she knows about it. Actually, she's watching right now. I see her watching.
I would love to meet her one day.
My mom is pretty amazing. She was a single mother, or is a single mother, who raised 2 kids, and she's our idol. Yeah. We love her for sure.
and tell us who that second kid was. You have quite a remarkable brother as well.
Yeah, I have a brother who's really done well for himself. So he's an actor. His name is Winston Duke. And I think his most famous role so far is he played M'Baku in Black Panther, the movie. I swear, this is crazy what's happening.
It's all good.
And so he is an actor, lives in Los Angeles. I live here in Las Vegas. My mom goes back and forth. And he's also a pretty, cool dude and humanitarian.
Yeah, and I saw he got the Australian GQ Actor of the Year in 2019. That's a pretty...
He did. He was actually supposed to go to Australia to receive that award, and then the bushfires started. Right. And all that stuff the world has been through a lot in the last 2 months. And so that ended up delaying him, and he couldn't go, but it was quite an honor. We're very proud of him.
Yeah, I know. I would be proud of him too. So I want to dive into Corona now. And so, that's really, I love talking to you, but I want people who are listening to us to learn a lot about the coronavirus and what it possibly means to them. And so I'm going to ask you questions. I know you haven't seen this list, and I hope I don't embarrass you at all.
I'm ready.
Okay. So, this is a little bit personal about your brother, but have you told him to freeze his sperm because of coronavirus?
I did. Let me be honest. I told my brother to freeze his sperm. Also, I really went through what egg freezing was with him. So he's now been telling his friends to freeze their eggs and freeze their sperm. And he's like my little fertility preservation champion out there.
I love it. And then what about embryos? Do you think people should be thinking about their fertility and preservation and freezing embryos as well if they're in a relationship, or even if they're single?
Yes, I think for both. I actually encourage people, if you have enough eggs, particularly women, to freeze eggs and embryos. The truth is, when we say embryo, we're talking about a fertilized egg, meaning you have to use sperm. And so if you have a partner and you're creating embryos, that's wonderful. But we also have to be mindful of the fact that some relationships come to a close. And so if the relationship ends, the embryos may not be, you can't use them if the other person isn't willing for you to use them. And that's especially true for women who have a finite time in terms of their eggs. And I know you have the Tushy method, etc. And so I encourage my patients to strongly consider, yes, creating embryos if you're married, engaged, have a partner. It certainly helps you stop the clock, absolutely. But I also encourage them to freeze eggs as part of that plan should the unfortunate occur.
Sure. So are you like me, when you watch the news about the coronavirus, do you sometimes like roll your eyes and say, I cannot believe they're talking about this right now?
Yes, I actually think I probably roll my eyes way more now than I've ever done before. I've decided at least I'm getting exercise for my eyes, for the eye muscles.
Okay. So
because I roll my eyes a lot.
Yeah. So what was trending yesterday, and I couldn't believe this, was farting out the virus. And I was like, are you bleeping? You know what I'm trying to say? Are you me? Like, I could not believe that they were showing like farts and like, but seriously though, I mean, you hear these studies showing that even when your nasal swab is negative, you could be positive in your saliva and your poop.
Yes, you can have it in poop. I really don't know exactly how many viral particles will aerosolize and come out as part of a fart. But is it in poop? Absolutely. There have been multiple studies that show viral RNA particles, so the code for the virus being detected in stool. And so that's possible. And yes, farting might be an extreme, but I think it at least jars people into realizing that if you aren't washing your hands properly after using the bathroom or after cleaning your children or your loved one who you're caring for, you might end up transmitting the virus because you're touching fomites. So yes, I'm not sure that you'll get enough particles
from a fart,
but the concept, I think it's worth exploring for poop side. Yes.
Right. So I mean, your pants are kind of like a mask for your butt.
Yes.
And then you have a mask for your face too. Yeah. I mean, okay. So, when I go to get groceries and then I come home and I'm looking at that bag and I'm asking myself, just knowing how you can get coronavirus. And I see news reporters talking about how you got to wipe down that grocery bag, and why? Like, why is that? Why?
It's because the viral particles can remain viable. I mean, not using the word survive because the virus itself isn't alive, but it's viable, meaning it's capable of being infectious for different time frames depending on what surface it's on. So for example, plastic, it can survive on plastic well up to 24 plus hours. And so if you have plastic bags where groceries have been delivered in, for example, if you went and you purchased them, the recommendation is that when you arrive home, you get them out of the bag right away and just rinse them underwater. If it's stuff in plastic, fully sealed plastic or cans, you can wipe it down with a disinfecting wipe. But the big worry here is that some people may go overboard, right? Because you don't want to contaminate your food with what you're cleaning it with. And I think that's where I've started seeing some really scary stories out there of people using bleach to wash their meats and so forth. Don't do that. There really isn't that much particles, and there have been no reported cases so far of someone contracting the virus from their groceries, if we're being honest. It's a precaution, but there's no report so far.
Right. Okay, so let's say, here's my coffee cup. I mean, how could I get coronavirus from this? Would it be like I'm snorting the cup?
Yeah.
I mean, I'm being totally serious. Like literally.
If you get your coffee, clean your hands. I've been to the Starbucks drive-through during this pandemic, and certainly they're using gloves there. But when you get it, just exercise caution. So I've been watching, certainly they're not putting their hands on the lids anymore to seal your cup, which is good. Just make sure it's sealed when you receive it. Don't burn yourself, but clean your hand, have an alcohol-based sanitizer in your car if it's the drive-through. And you need thousands, actually millions of viral particles to really induce a full-on infection, to be perfectly honest. So it's more practicing hand hygiene, wearing your mask when you go outdoors, maintaining your distance as much as possible when you're out, and using common sense. So I wouldn't cough on the cup. I wouldn't if you see someone cough on your coffee cup before giving it to you, maybe that's not your coffee.
No, that person's not your friend. I don't think they like you very much if that's happening. Okay, cool. Well, thank you for those tips. Let's talk about immunity, vaccines, and antibodies. Will there ever be such a thing as immunity? I mean, you hear things like, oh, you'll be immune if you get it, but like, really?
You know, on the one hand, I have to say I'm very heartened to hear everybody talk about immunity. The vaccine biologist in me is just excited that people are using the term immunity. The problem is that immunity can take on very different shapes depending on what is causing an infection. And so right now, you know, we're not sure if immunity for this particular coronavirus known as SARS-CoV-2 is lasting. And that's because coronaviruses have been around for a while. The most common one that we all know is the common cold. When you say you have a cold, for the most part, you're probably sick with a coronavirus, the common coronavirus. And the reason why people can get the common cold repeatedly over their lifetime is because the immunity isn't lasting. Also, the virus mutates over time. And so the immunity that you may have developed last year when you were infected is different from the immunity that's specific to the virus that you may be exposed to a few years later. And so what we don't know yet is whether this particular coronavirus will cause the same picture. However, antibodies are a different thing. Someone can have antibodies and not be immune. And that's the key to know there, because we're about to use antibodies in the context of clinics. Certainly here in fertility clinics, I am a huge advocate for us getting those antibody testing so we can at least start figuring out who's been exposed. We can start figuring out who amongst our staff, who amongst our patients, especially for those who are using, say, sperm donors, in particular egg donors. We're going to need to know these things before people start going in and out of clinics again. So we'll use antibodies to figure out if someone has been exposed. It may not necessarily be a protective antibody in that they may not have immunity, but we'll be able to inform our public better, because the truth is right now, a lot of people out there have been infected but didn't have symptoms, and therefore they don't know their status.
So before this show, I did a survey. I asked 10 people. I said, no access to Google.
Yes.
I said, just tell me, what's the first thing you think of when I say the word antibody? And the next word they said was screen. So I think that we hear that term antibody a lot right now. You hear the scientists on TV talking about antibody testing.
Yes.
But let's say I'm in the 3rd grade. Like, what is an antibody? What does that really truly mean?
Yes, you have really smart friends there, Dr. Aimee. Screen is really the right word.
I'll tell them you said that. Coming from me,
I'm very impressed. Screen literally is what antibodies allow us to do. We can screen people to see if they've been exposed to a virus. Now, some antibodies also tell us if some people are protected for an infection. But for right now, the most correct way, if I were talking to a 3-year-old, is to say, I need to check somebody's blood to see if their body had ever seen the virus before. That's really the purpose of the test. And the tests are specific enough that we can even gauge for many people whether or not they saw the virus, their body saw the virus in the last 5 weeks or longer than that. And so we look at different types of antibodies, IgG, IgM, and it can help us with that information. But it in no way would mean that somebody is now immune. And I worry that a lot of people, as they hear about antibody testing, think it means that they're being tested for immunity. We don't know that yet, because actually antibodies aren't usually the primary form of immune protection if you're talking about viruses.
Interesting. So fascinating. So then now comes the vaccine part, right? And so I think of this vaccine, I mean, as something that a lot of patients are thinking of as like some superhero that's gonna come and save the day. And I have patients that say, Aimee, I don't want to get pregnant right now because I just want to wait for the vaccine. And I'm like, I don't want to, burst your bubble.
Yeah.
But I don't know that that's something that we should be waiting for, because the reality is it may not, I think of it as like the influenza flu vaccine, right?
Yes.
So talk to us about the vaccine and what we should know right now.
I think it's important to point that because, as a viral vaccine biologist, virologist, I would tell you that one of the most frustrating things about developing a vaccine for a virus is that they're not usually protective in the sense that the general public is expecting. The purpose of a viral vaccine is to prime your immune system so that the next time it sees the virus, if you're exposed for real, like a real infection, it can help you fight it off before you get too sick. And that's really most likely going to be the goal in this situation with coronavirus. Now, a vaccine, we're hopeful. We've all heard the amazing stories that we may have one in as soon as 12 months, which would be awesome. But I will tell you guys, that in itself will be a scientific landmark story. Yeah. Because vaccines actually take a lot longer, especially viral vaccines, for the very reasons you alluded to, Dr. Aimee. So first is because viruses mutate more rapidly usually than bacteria, for example, the vaccine that you develop can really only usually target some of the viral types that are out there, but not all of them. Many times you end up needing boosters before you can really see any immunity. So if you think, say, the chickenpox vaccine, you think of a number of the other viral vaccines, because chickenpox is a viral vaccine. We actually have to give someone a shot once, and then 2 months later, you give them a second shot, just so that their immune system is primed enough to truly recognize this virus to give you something lasting in terms of the memory or the protection. And those are some of the things that still have to be figured out. Plus, like I said, so first step is designing the vaccine. A year is pretty amazing. We do have some candidates out there, but as someone who did vaccine design for 4 years, I would tell you that every year people were changing the vaccines, even for the things we were researching, because new things were being discovered about the virus every day. In the context of coronavirus, this particular virus is really new to us. It's only been around since, in terms of the media and public knowledge of it, since maybe December, possibly November. So they're still learning about it. So even the first sets of vaccines that we're testing now may not be very effective because they were designed based on some of our early information. And we're still gaining details about the virus. And so it's important to let people know that, because in a year, there might be a vaccine. It may not be super effective, but if it is, they'll probably give it to our frontline workers first, our healthcare workers, our elderly, and then a newer version will probably have to be worked on over time. And also, like you said, with the flu, we may actually see a different version every year as they start predicting the mutation in the virus.
Right. I mean, and then we all know that sometimes the influenza vaccine hits the mark and sometimes it doesn't as much.
Exactly, because a vaccine design for something like influenza is based on what we call predictions, right? And so there are really smart people out there using computer models, epidemiologists who are following trends. So for example, here in the United States, the flu vaccines that we usually get are based on trends, looking at different countries in Asia, etc., to see which flu viruses are most predominant in the 6 months to a year before our flu season starts. And then they use computer modeling to predict how that virus may mutate or recombine to predict what's the best one for us. And sometimes the computer gets it just right. Other times it's off. And so, that's usually when you hear people say, oh, flu vaccines don't work. That's not true. They work because for most people, if you've been vaccinated, you don't get so sick where you're landing in the hospital needing to have a tube down your throat and a machine helping you breathe if you've got the vaccine. But I think it's because we've simplified what vaccines mean. People assume vaccine equals preventive. And when it comes to viruses, it's not that it's preventive, but it's more what we call therapeutic or blunting the response, making you more likely to just be mildly symptomatic and not severely ill.
Right. So it might not be that superhero that's going to come in and save the day. And so it's just important for people to know that. I tell my patients, don't let the pandemic take away your joy. And the vaccine isn't going to bring back the joy. So you have to find ways to bring back that joy. I should come up with a a bumper sticker to put on my car.
I like it.
Okay, so here's the other thing that just fascinates me, and I want to hear your input. So if I'm at home, I'm not going anywhere, and I haven't been anywhere for like 4 weeks.
Okay.
Do I need to be washing my hands when I go from my computer to my bathroom, to my TV, to my, like, I'm alone at home. Like, I hear people, like, I'll just say maybe a family member of mine who might be watching, so I'm not going to call her out. She's like, Aimee, I washed my hands so many times today. I went to the bathroom, I washed my hands. You know, I'm like, okay, I get it. You're washing your hands every 5 minutes. Do you really need to if you're home alone and haven't seen a human being for like the last 2 weeks?
I would say it's good habit, right? It's just a good hygiene habit and practice to be developing. And so we know practice makes perfect. If you're doing it at home, when you finally head back to work, head back out into the world, you're more likely to keep doing it. And so that would be my response to it. I wouldn't get into a deep argument as to whether you're still shedding virus.
It might be my mom, so I don't like arguing with her. So
I would say this, right? We know that people who actually were infected with the virus and have been tested for evidence of the viral particles, they found it 21 to 39 days later that they were still shedding at least viral RNA. And so while you may be home and asymptomatic, you might be shedding virus, but can you reinfect yourself with the same one? We don't know that yet, but I would say let's just practice the habit. That way, when you're outside, it's easy to remember to clean your hands if you were doing it at home.
Okay, so then this other scenario, let's say this person has been at home this whole time, and then let's say I've been at home this whole time.
Yes.
So we're both quarantining and our, sheltering in place in our own homes. So we haven't seen anyone for the last, let's just raise it to 4 weeks.
4 weeks.
Now we want to come together, 2 people. Would you say don't do that? And if you did, you have to stay 6 feet apart? Or would you say, yeah, it's okay for you guys to give each other a hug now?
You know, that's where the antibody screening comes in, because if we can screen people, we can give a little bit better sense of what each person's status is. And I say that as someone for whom this question that you're asking, Dr. Aimee, very specific even to me, because my mom is a diabetic who also has high blood pressure. She has been locked in for 2 months at this point. I haven't seen her for 3 months, and usually I see her weekly. And yet my big worry is, what if I'm an asymptomatic carrier? So I'm shedding virus, but I don't know. And if I go visit my mom, could I expose her, even though both her and me, we've both been very much isolated? I've been now isolated for 2 weeks, but I don't want to run that risk until I know more. So I'd like to see that she's been tested. What is her antibody status? And the same for me. Because we don't yet know if someone is asymptomatic, does that mean they truly clear the infection in 2 to 4 weeks? Or is it that their body has developed a happy medium with the virus and they're still making it, shedding it, but not symptomatic? We're not sure yet whether that's the case.
Mm-hmm. Yeah. Totally random question. Do you hug your patients?
I was before. Yeah. And I have to tell you, this has been the hardest part, because usually I hug my patients, I hug the pregnant ones. I definitely hug patients who are experiencing pregnancy loss. And my staff joked, because back in early March, that was my challenge. Like, I had a patient, I turned 3 times because I kept wanting to go in for the hug, because it's so natural and so much part of my practice.
Yeah, I had a feeling. Same thing. It's really tough. It's
hard.
So hard. I'm like, I want to come in for that hug right now. And it's so hard not to be able to.
That's the other thing, I think that this pandemic has shown us is we're all way more social and way more touchy-feely than we probably even recognized about ourselves. Right.
I mean, I feel like our masks, you know how you see all these mask designs? I feel like they should really have a smiley face on the outside, right? There should be someone out there that makes a smiley face mask. So we're just walking around with smiley faces so we see that rather than just like, and I know there are people that are getting super creative, and I appreciate that.
There is a mask out there that has a transparent covering for people who are mute, people who can't talk, right? So that you can still see emotion on their face. Because certainly for most of us, when we're talking and thinking about our masks, we're not considering the people who are unable to speak. And so someone was creative enough in thinking about that group of people. And there are masks out there like that. It's not, widely available, but it's been designed and it has been marketed.
Yeah. So there's another thing that's going around. There's a picture of people with masks.
Yes.
And then it shows like one person with a mask and one person with a mask.
Mm-hmm.
And then it says the risk of transmission is 1%. Is that true? Is that really true? That if I'm sitting here 6 feet away from, let's say, a patient, and we're both wearing masks, that it's almost impossible for us to infect each other?
The risk of infection is way lower, yes, if you're 6 feet minimum apart. But notice it's a combination. So it still means you're, maintaining physical distancing, wearing the mask correctly. So that decreased risk of transmission is dependent on you wearing your mask correctly, meaning you're sealed it off here, there's no leak around the sides, and both people are wearing it appropriately. It also means they're washing their hands, the whole general surroundings are clean. But yes, you can significantly decrease the risk of transmission into the single digits, really, especially if you're greater than 6 feet apart.
Yeah, I think I need to reach out to the mask makers to make a special ones for big noses, because I swear these masks do not fit over my nose.
But it's so important, I've seen so many people's pictures. That's like my new hobby on social media, is looking to see if people are wearing their masks correctly. Or yesterday I went to the supermarket and my attendant, I was that lady who told him, you're not wearing your mask correctly, because he had the mask on, but it was under his nose, right? And it was right. And I was like, no. And I was like, well, Cindy, you became that lady.
And I'm sure they know who you are, so they're going to listen to you. So do you think in the future we'll have movies, rock concerts, graduations, and weddings? And if not, like, when is that going to happen and how?
I think it's at least 12 months to 2 years away. I think, if we're being perfectly honest, outbreaks will continue to happen even after we have containment. And every modeling has shown that, but also we're starting to see outbreaks in places that previously said that their numbers were zero. Wuhan, China. We've seen outbreaks in Singapore. We've seen outbreaks across the world, even after people had control. And that's because, one, we don't know about immunity, like I was just talking about. So I know a lot of people are using the word herd immunity. The herd isn't immunized yet. So we don't have herd immunity just yet. But even if we were to apply the context of herd immunity, it may not have worked for this virus because we may not have lasting immunity to begin with. And so, yes, in the next 12 months to 2 years, I foresee us limiting those large gatherings, which I know it's hard for a lot of people. It's just, I'm a girl, I like my Coachella, I grew up in the Caribbean, I like going to Carnival. But I do think that we need to prepare to have a new normal for the short term.
And so that probably means schools too. Do you predict that kids are going to be going back to school in the fall?
I think by fall, yes. But do I predict that kids will be going to school wearing masks? Probably. Teachers for sure. I
can't believe I didn't even think about that. Wow. Yeah. I mean, I didn't even think about that.
I think kids would be, we'll have some child-friendly masks. It can't be all kids, though, right? Because infants, you have to be aware of what's going on with them. But I think there'll be a lot of new normals. I think schools will have different, even the way they clean the school. And it's scary to think of. And I don't want to be alarmist because we will get through this. We will get through this.
Oh, absolutely.
But I think it's important to plan that, yes, even when school resumes, kids, there'll be a lot of things having to reteach your kids about distance and friends and socializing and even what the long-term consequence of even those things might be on the kids.
Wow. Okay, so I want to just move to COVID and pregnancy.
Yes.
Okay, what are you telling your patients right now?
I'm telling them that the data so far suggests that coronavirus isn't conferring increased risk of bad things if you're generally healthy. My patients who are what I would call high risk, so I have patients who are diabetic, those who I'm still working on convincing to quit smoking, that sort of thing. I explain to them what this might mean for them if they were to become infected. We know so far from studies, some small, but now even bigger studies are starting to come out, that being pregnant doesn't increase your chance of getting infected with the virus. We know that. But what we do know is pregnant women who have underlying disease, if they were to become sick from their infection, they can have really bad outcomes that range from miscarriage, stillbirth, all the way to needing to be on a ventilator themselves, either in labor or shortly after labor. And so my recommendation to patients is really in line with what the CDC has said to patients, which is if you're pregnant, whether you're a healthcare worker or not, you should avoid anyone who you know to be infected. While they're infected, avoid them, and avoid people who you know have been exposed. So if you know people who actually know someone who tested positive, they were in their close proximity, etc., then you should practice social distancing. If you live with that person, then isolate. They should be isolated while they're recovering or going through quarantine.
And you hear of women who deliver a baby and they require everyone who comes to visit the baby to have had a whooping cough vaccine, for example.
Yes.
Do you think that that's going to be the new thing, that like before you can come visit my baby, you'll need your
antibody test?
Maybe?
Yes, I think so. I definitely think, right now the hospitals themselves are implementing things like that as we speak. So for example, if a woman shows up to most labor and deliveries across the country right now, she's being tested, so is her partner. They're restricting visitors. And I think if you go home, you should do the same. You should restrict visitors for now. While we're telling people from all the data that babies seem to be doing better when you compare them to adults and elderly who are exposed to the virus, it doesn't mean a baby, a neonate, cannot get infected. And so you need to still practice those precautions when you deliver. Yes. Eventually, when testing becomes widespread, I would say, yeah, they should be tested. If you haven't had your vaccines for chickenpox, pertussis, which is whooping cough, etc., you should not be visiting anybody and their baby in the first year of their life at all. That's just a personal responsibility. And I think the same goes for coronavirus. If you know you haven't been tested, you haven't checked, then you're only helping the family by not visiting them. I swear, this little bee is.
I love it. It's adding excitement.
It's very social.
When is it going to come next? So, what about eggs and sperm? I mean, can an embryologist in an IVF lab give it to an embryo? I mean, I tell patients, no, they can't. Like, that's not going to happen.
I don't see that happening. Okay. I think, so the good news is so far, a lot of people have started studying whether or not you can find the virus in semen. And there have been multiple studies that show it is not in semen. Then one study, albeit small, actually went so far as to biopsy the testicles.
Men, hold your ears. I'm sorry. We're not going to talk about what's involved. Sorry, guys.
I'm amazed that they volunteered to do that, but they did.
I think they probably got paid. They would have to have gotten paid.
I would hope so. I would hope they got paid very well.
Yeah.
And what they found was no virus. Now, there's a caveat to that study, which is it was a study done in men who had been infected, confirmed positive for coronavirus, recovered, and then they tested them. So they didn't test people who were positive and actively having symptoms to see if, but at this point, we're also not expecting that people who actively have symptoms are going to be doing the do or coming into fertility clinics.
Yeah, I mean, you're not having sex if you're having symptoms with COVID, right?
Yeah,
I mean, that's just like not, I don't think so.
So I think that study is very helpful because it gives us some reassurance that it's not in the testicles. Nobody's looked at the ovary yet because, let's be honest, ovary and eggs, very, very precious. We're not going to just start biopsying ovaries of women, human beings rather, to look for eggs and coronavirus.
Right.
But knowing what I know about coronaviruses, no, they don't integrate their DNA. It's not like, say, HIV, etc., that puts its DNA into your DNA. It's not going to be even in what we call the nucleus of the cell, which is where the genetic material is stored in the egg or the sperm. So no, I don't think so. I think, the good news to let everybody know is embryologists practice what we call universal precautions in the laboratory anyway.
They're already wearing masks and hats mats and scrubs.
Everything. Plus, most labs have what we call positive pressure. So it actually has a special air system that's pushing any particles out of the lab and not drawing it in. And so I think patients should be reassured that laboratories were designed to cope with something like coronavirus long before we even knew this was coming.
Right, absolutely. Okay, Cindy, thank you for joining us today. I really appreciate all your time. I know that I was cracking jokes. I know this is a very, very serious subject, and I'm not trying to make light of something that's super serious. So thank you for humoring me at times and sharing your wisdom. So for people who are watching you and say, wow, like I really want to see Dr. Duke as a patient, how can they find you? Can you tell us?
Well, they can find me. I'm all over social media. So you can find me at Dr. Cindy M. Duke. So Dr. Cindy M. Duke on Twitter, Instagram. I'm here on Facebook, Dr. Cindy. You can go to my website, drcindyduke.com, or the clinic's website, which is Fertility Nevada. And I'm doing telemedicine. That's a big thing for me. And so you can see me by video right now or in person. And you can also call for an appointment at 702-936-8710.
And if there's one thing that you could tell a fertility patient right now, what would that one thing be?
I would say that right now, I know it feels like hope is lost, but the truth is we're coming back. We're bouncing back. And all of your fertility doctors, including those like me who actually also studied viruses, have been working very hard to make sure that you're safe, your embryos, your eggs, your future babies are safe. And we will be back. Some clinics actually are back already. My clinic, we've started doing some treatments again as of this week. But hope isn't lost, and your safety is the number one priority in everything that we do. I mean, I know you love your patients, Dr. Aimee, so do I. And this is truly a passion. It's not like just business. We went into this because we believe in it, and we believe in families.
Absolutely. Sometimes I would say that I have a PhD in toxic positivity. I'm not letting any pandemic get in that way.
Yes, and I think that's true. As fertility specialists, we're some of the most hopeful people alive.
We are. Someone called me a hope dealer one.
Yes, I believe that. We traffic in hope a little bit.
Okay. Okay, cool. Well, have a wonderful day and rest of your week, Cindy. Thank you for joining us. Thanks everyone for watching the Egg Whisperer Show, and hope you'll tune in tomorrow. Bye, guys.
Bye.